where the FDA is now reviewing Moderna's COVID vaccine right now. Now, if this one is approved, this would become the second vaccine available in our country. Now, this one's going through the same process as the Pfizer vaccine. An FDA subcommittee has been talking about this all day. Now, once they give it the okay, the full FDA has to vote to grant it emergency use. After that, the CDC has to give it the green light. Once that takes place, it'll be shipped across the country. Now, a plant in Bloomington has been processing this vaccine. We saw this one in action earlier this week when Vice President Mike Pence was in town visiting. The Catalent facility is expected to ship 20 million doses at the end of this month. Now, there's also one big difference between the Moderna vaccine and the one produced by Pfizer. The Moderna vaccine doesn't have to be kept quite so cold. Pfizer's has to be kept at minus 94 degrees. Moderna's only has to be kept at minus 4 degrees for long-term storage. However, it can be kept at 40 degrees for 30 days, making it easier to transport. Well, more doses of Pfizer's vaccine are now showing up at hospitals across central Indiana. I want to give you a look at the first dose to arrive at Ascension St. Vincent earlier today. They will start vaccinating their frontline workers tonight. Our Rich Van Wyk shows us how central Indiana hospitals are now preparing to give these shots of hope.
There's a surprise inside all the boxes of vaccine arriving at hospitals. Each vial may contain 1 or 2 more doses than expected. Franciscan Health figures it can vaccinate about 125 more people than it planned on from just this one small shipment. Its clinic opens tomorrow. IU Health, the state's largest healthcare network, will open about half a dozen clinics Friday. The first opened Wednesday. According to a spokesperson, it ran exceedingly well. Not one of the roughly 200 people vaccinated suffered any adverse side effects. IU Health expects another 8,000 doses to be delivered Monday. Finding just one more dose in each vial could add up to 1,600 additional vaccinations. Nearly 2,000 doses arrived at Community Health today. 2,000 frontline healthcare workers have already signed up for the vaccinations. They start tomorrow. Ascension will have clinics running in 5 of its hospitals. The St. Vincent Hospital location plans to vaccinate almost 800 people in just one day. Smaller hospitals will be just as busy. Hancock Health in Greenfield just received its vaccine. Its staff intends to vaccinate 4 people every 10 minutes. Health officials believe the sooner people are vaccinated, the sooner the pandemic will be over and more lives will be saved.
And I want to let you know just moments ago, the FDA has now approved this Moderna vaccine for emergency use authorization. So now it will go on to the full FDA. Now, as you may imagine, there's been some confusion over finding 6 or 7 doses of vaccine in a vial that's only supposed to have 5. Today, the FDA weighed in, saying it's okay to use those doses. Now, nationwide, that could add up to millions of additional vaccinations. Well, Vice President Mike Pence and the Second Lady will be getting their COVID shots on camera tomorrow. The Surgeon General will join them. Now, we don't know yet when President Donald Trump will get the vaccine. Remember, the president was treated for COVID-19 at the beginning of October. Doctors don't know how that treatment will affect the vaccine, so that may be why they are delaying the president's shot until sometime next month. Well, we are all hoping that by early next year, the vaccine helps bring these numbers of cases way down. Today, Indiana added another 6,400 positive cases to the list of patients. So I want to talk about the positivity rate for a moment. Remember, the goal that we've been talking about every night is to be below 5%. As you see, we're way above that right now at 12.4%. But we've been holding fairly steady over the last few days. Now, that number is super important because it shows how the state of Indiana is measuring if we're doing enough testing to catch the spread of the coronavirus. Happening right now, Congress is close to a deal on another round of COVID-19 relief. It's a rare compromise in a time of crisis. NBC's Alice Barr shares how this bill could help millions of struggling Americans.
A desperate dash on Capitol Hill as lawmakers race to prevent a government shutdown and pass a COVID relief bill before the holiday break.
We're going to stay right here, until we're finished.
Bipartisan negotiations finding new urgency in the lame duck Congress as the pandemic intensifies, forcing more businesses to close. New unemployment numbers out today show a higher than expected 885,000 Americans filing for the first time. And in the middle of that pain, millions are set to lose unemployment benefits the day after Christmas.
We see food lines of people who never, ever in their lives expected to have to go to a food kitchen to support their families. It is a crisis.
Lawmakers are hammering out the details of a $900 billion package expected to include a new round of stimulus checks, likely about $600 for those who qualify based on income, extended federal unemployment benefits of about $300 a week, and more money for small businesses struggling to stay afloat. The framework does not include money for state and local governments, liability protection for businesses, or significant support for the hard-hit restaurant industry.
Democrats say they're willing to compromise because they're counting on a bigger relief deal next year once President-elect Joe Biden takes office. In Washington, Alice Barr, NBC News.